Hello, this is Eric Topol at Medscape, Medicine the Machine, with my co-host, Dr. Abraham Verghese. And today is a really special podcast that we get the chance to have a conversation with Peter Hotez. Peter is the Dean of the National School of Tropical Medicine at Baylor. He is perhaps one of the most accomplished academicians in infectious diseases and tropical medicine, and certainly he's been preparing for the pandemic, perhaps unknowingly, for decades. His background, BA at Yale, PhD at Rockefeller, MD at Cornell, and he has a new book, Preventing the Next Pandemic, and has all sorts of things that he can enlighten us about. So welcome, Peter.
Well, thanks so much, Eric, and it's a thrill for me to be here. Both you and Dr. Verghese are two of my heroes, and so I feel very honored and blessed to have the chance to talk to you.
Well, thanks, Peter. You know, I don't really think there's anyone that's had the panoramic view that you do regarding the pandemic and the antecedents of the pandemic with respect to the social, the science and anti-science, the actual molecular biology, vaccinology, vaccines. So you're the go-to source here. So we're really, this is a great opportunity. I'm going to turn it over to Abraham to get things rolling.
Peter, what a pleasure to be speaking with you, and hats off to you also for being out there and speaking reason to people who are not always willing to listen. I'm curious, this latest book of yours, did you conceive of that during the pandemic, or was it something already in the works? Because it's incredibly timely and needed, the fact that it's coming out at this moment.
Well, actually, it actually was almost done before the pandemic, and I had to work with Johns Hopkins University Press to scramble and write in some information about COVID-19 because COVID-19 was obviously so dominant. So that was actually became a theme of the book, that when people talked about COVID-19 being this extraordinary event, I said, no, it was actually more of a culminating event of lots of unraveling in different aspects of global health. And I think the other piece to it is that the things that were causing the unraveling are generally things that none of us ever got trained to ever think about during our medical training or our scientific training, things like war and political collapse and climate change, and of course this aggressive anti-science movement and urbanization, and I think, and that's also a wake-up call to think about how we need to re-envision medical education to train people to think more broadly than the way we do it right now.
In the book, you developed the concept of vaccine diplomacy, and you've also worked on a vaccine for COVID in India. Can you tell us about all that?
Yeah, so the vaccine diplomacy piece is something that I've been really interested in for years, noticing how when the first polio vaccines were developed, they were done jointly between the Soviet Union and the United States at the height of the Cold War, two countries placing aside their ideologies to work together to prepare this incredible life-saving technology. And then we cooperated with the Soviets again for smallpox. And so I'd been writing and speaking about that. And in addition to being a working scientist, doing what working scientists do and keeping up with the grants and the papers, and finally got tapped by the Obama administration to actually try it out, which was really exciting, and did that with Muslim majority countries in the Middle East and North Africa. So that was very fulfilling. And then the other piece to that is we had been, I'm not really a virologist. I'm mostly interested in parasitic diseases, and devoted my whole life to developing vaccines for poverty-related neglected diseases that no one else would touch because they're only for the poorest of the poor across the world, and schistosomiasis vaccines and Chagas disease vaccines and leishmaniasis vaccines. And for similar reasons, we adopted a coronavirus vaccine program about 10 years ago with working with the New York Blood Center, because they couldn't find but they had some really interesting ideas and approaches, but they couldn't find anybody to actually shape it into a vaccine. So we adopted it and wrote funding to the NIH because nobody cared about coronavirus vaccines back then. And so we got really good at showing that the spike protein is the target of the virus, how to deliver the spike protein, how you induce virus neutralizing antibodies. And then when the COVID-19, and we actually manufactured a SARS-1 vaccine and came close to a MERS vaccine, so that when the COVID-19 sequence came along, we were able to turn that around pretty quickly, and now we're scaling up production of a COVID-19 vaccine in India and Hyderabad with Biological E, and they're producing 1 billion doses, and it's looking really good, and we'll talk more about that. And then I also have a daughter with autism and I wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism, which made me public enemy #1 with the anti-vaccine lobby. So all those three things, vaccine diplomacy, COVID-19 vaccines, and fighting this horrible anti-vaccine movement, all positioned me really well in 2020 and 2021, because those were the three of the big themes for this year, unfortunately. But so it's been an opportunity for me to really speak about all three issues.
I can't think of anyone with more of a personal stake in the vaccine issue, as you demonstrated in that beautiful book about Rachel and her autism. And I'm wondering if you can edify us on the anti-science, anti-vaccine movement. I think there's a perception that it's uninformed, but it can actually be pretty sophisticated at times. And I think the theory that if we just inform the public, people will make the right decision turns out to be not true, that the more informed they are, the more sophisticated the contrary arguments they develop. And I'd love to hear your thoughts on that.
Yeah, it started as a small fringe group after the Wakefield paper in 1998 that claimed that the MMR vaccine causes autism. But then it took twists and turns and accelerated in three major areas. One, and there is still that theme of claiming vaccines cause autism even today. That's kind of the legacy fake assertion for the movement, but it's taken on three additional dimensions. One was starting in 2015. It was losing steam, in part because a number of us were debunking the claims that vaccines cause autism. We had provided, I think, a pretty impressive scientific body of evidence showing there's no link and giving an alternative to what autism is, and through whole exome sequencing and how it begins in early fetal brain development. So the movement needed to re-energize, and the way they re-energized was they took a political spin. They connected themselves with the Republican Tea Party starting around 2015. And that was in response in Southern California, where Eric is, but actually a little further away in Orange County, when the California legislature closed vaccine exemptions. That was a rallying cry around this concept of health freedom, medical freedom, and it really accelerated across Texas and Oklahoma and took on a political badge. So actually, far right-wing Republican political action committees started to form, and we started got money and organization from the Republican Tea Party, and then of course it took on an added dimension in 2020 when it not only became a protest against vaccines and health freedom, medical freedom, but masks and social distancing. And that's why you saw the big wave of COVID-19 in the southern states in the summer and up in the upper Midwest. It was for a while, it was mostly a red state disease because of that health freedom, medical freedom component. And then it actually exported to Western European capitals linked with QAnon, as reported by the New York Times and BBC. So it took on this very dark turn very quickly, and now you're seeing this play out nightly on Fox News. For whatever reason, the leaders at Fox News have decided that they're going to go on full anti-vaccine, and you're seeing these network anchors, not so much the daytime ones, they're less ideological, but the nighttime ones are just, really doing everything they can to discredit vaccines and discredit scientists. And now it's mainstream in the Republican Party, which never used to be the case. So the anti-science is now a major platform of the Republican Party, and that's really scary for the country. And then, because that's not complicated enough, you have Putin and the Russian government, and this has been reported by U.S. and British intelligence that they've been creating this whole system of weaponized health communication. That's the term they use for the last few years. And then when the Russians tried to push their Sputnik V vaccine, one of the ways they did it was to use that mechanism to discredit Western vaccines and to make this whole anti-vaccine component. And then we've got homegrown groups like Children's Health Defense and others around the anti-vax, really promoting anti-vaccine attitudes. So you've got this triple-headed monster of Russia and far right-wing extremism that's now mainstream in the Republican Party and dedicated anti-vaccine groups, and they've got money and clout and a lot of power, and that's what we're seeing play out right now. And in the past, and this is one of the arguments I've had with the international global health community, is they've always said, Peter, it's sort of walled off to North America, maybe some parts of Europe. It's now a full-on globalized anti-science, I don't know what the word you want to use, empire or confederacy. And I think we have to do something about it, because for years and years, I've been saying this is going to be a big issue. And all I ever got was, Peter, you know what? We're not going to call attention to this because we'll just give it oxygen. You shouldn't, they would contact, leaders of the federal government would contact me and say, Peter, you shouldn't write that because you're going to give it oxygen. You're going to give it more attention than it deserves. And my counter argument is always, really? People don't have compact computers and dial up and ask Jeeves anymore. The world has expanded, and now here we are.
Well, you were prescient on that. You had an amazing essay in PLOS Biology recently, Antiscience Kills, From Soviet Embrace of Pseudoscience to Accelerated Attacks on U.S. Biomedicine, for those who want to get deeper into this, because you really lay it out there. The question, I guess, pertaining to exiting the pandemic, which I think there's a unanimity of interest in that. Do you think that this anti-science and as you say, the politicalization is going to prevent or just delay our emergence out of this mess that we're in?
Well, I think it's having already an effect. We're already so we have multiple news polls now in the United States from the PBS NewsHour. We did a poll with a group of Texas A&M, the Kaiser Family Foundation, Monmouth University in New Jersey, all found the same thing, that it's white Republicans overwhelmingly are the major vaccine hesitant group. And that's not a minority. That's a lot of people, right? So, and you're seeing this defiance against, and now Fox News has created this kind of tribal call to defy vaccines. And that's going to prevent us from getting to the levels that we need. Remember, now with the new variants, from the UK, the California one, they're pretty transmissible, and we're going to need a very high level of vaccine coverage. And I don't know if there's a magical number, but at least 75, 80% of the population will have to be vaccinated. And I don't know how we obtain that. And then globally, you're now seeing the Russians attack the AstraZeneca vaccine, and they're capitalizing on the cerebral venous thrombosis events, which are extremely rare events. But the Russians are piling on, and now we're hearing reports across Africa that people are allowing doses of the AstraZeneca vaccine to expire and going unused. And the vaccine ecosystem is very fragile. As I often say, it doesn't take much for even a good vaccine to be voted off the island if the public perception is against it. And we saw that with dengue vaccine, we saw that with Lyme disease vaccine, and we're going to see it with this one. So even though I think the AstraZeneca vaccine and the J&J vaccines are good vaccines, I don't know that people are going to accept it. So, and this is my point, anti-science does kill. People lost their lives from COVID-19 in the U.S. because of defiance of masks and social distancing, and now vaccines, and it's going to happen globally as well. And so my point is, we've got to look at this in a different light. And here's where I tend to be an outlier and alone on this one. I make a very provocative statement in that PLOS paper that anti-science is right up there with things that we build a lot of infrastructure to wall off, like nuclear proliferation or global terrorism or cyber attacks. We need to do the same with anti-science. We've got to treat it as seriously and confront Russia about it and do something about the anti-vaccine groups beyond just amplifying the message, because it's just a message in a bottle in the Atlantic Ocean right now.
I think that's a very powerful stance that you've taken, and a very powerful metaphor to say this is equal to nuclear weapons and so on.
But one question I have for you, Dr. Verghese, and Eric too, in our training, everything about our training says, Peter, don't go there. You're not a political guy. You're not, this is outside your lane. Just stick with the science. But at what point do you say that if you don't call it out, you can't save lives? And that was the dilemma I faced last year when I saw the whole Trump disinformation campaign unfold. And I was one of the first to see it, not because I'm so brilliant. It's just that for years I've been going up against anti-vaccine disinformation campaign. So I became an informal expert on it and saw what was happening when they were trying to shift deaths to other causes, or say masks don't work, or the COVID's a hoax, and spectacularizing hydroxychloroquine. And I saw the whole thing unfold. He watched Larry Kudlow and Peter Navarro and all these people, say these types of things, and you realize this was a coordinated anti-science disinformation campaign. And I said to my wife, Ann, I said, this is terrible. And here I am, a scientist. And Ann, to her credit, said, look, you don't want to wake up in a year from then and see all the people who've died from COVID-19 and feel like you haven't done everything you can to prevent loss of life. So I did. And it was a very dark place that I went into. And it wasn't that I wanted to go into the politics, but to tear the anti-science out of the politics, you had to call it out and describe it. And it was a very uncomfortable, dark place for me. And in the beginning, I didn't get a lot of backing from a lot of the professional societies, academic societies, or even the national academies. I was sort of out there alone, and that was a very tough time for me. Quite honestly.
Well, I think that sentiment to stay in your lane is clearly one that riled up the troops, and I don't know who said that to some physician group, stay in your lane, and it became a popular hashtag. Right. But I do think that you were really the pioneer in speaking out so boldly, and Eric too. I think you've taken your share of flack, and one of my questions was, how do both of you weather the attacks when they turn personal? I mean, and do you have a formula for how you've managed to, not take it personally?
Well, what I do, I'd be curious to hear what Eric does now, because I'm pretty active on Twitter, with mixed feelings about Twitter. Lady Gaga calls social media the toilet of the internet, and I think she's onto something. But one of the things that I do is, I get attacked all the time, and rather than sort of suffer in silence, what I try to do is I retweet it with a comment, because I try to use it as a teachable moment so that Twitter followers can actually, understand the nuts and bolts of anti-science movements, how they work. And I say, this one I think is coming from Russia. This one is coming from political extremism on the right. Here's why this is not true. So it becomes sort of a primer or a lesson in how anti-science operates. And it's there's not a lot of roadmap to follow here, but that's been one of my approaches that I've been taking.
Medicine and the Machine will be right back.
Welcome to Medscape's latest podcast series, Medicine and the Machine, featuring Medscape's editor-in-chief, Dr. Eric Topol, and master storyteller and clinician, Dr. Abraham Verghese. Remember, you can find the latest in medical news, expert perspectives, clinical tools, continuing medical education, and more at medscape.com.
What's impressive, Peter, is that you not only are willing to stand up, and especially, in many ways as a solo force, but you've also not just been on the TV networks that are supportive of science, like the MSNBC or CNN, but you also go right to the danger zone. Fox News, you've alluded to it, and you take the wrath of the Laura Ingrams and the Tucker Carlsons, and you by putting yourself out there, that are, of course, these people that are the extremists, they know, they see you, they go after you, so you become even more of a target. And your way of coming back to it, as you say, where you leave up the comment that the attack and you respond to it is pretty clever. But it takes a lot out of you. I wonder, would you still continue to go on a Fox News program after the kind of stuff that has been pulled?
Well, I publicly said I would, so I guess I have to now. So, and again, not to go to war. I mean, I don't want to go to war with Tucker Carlson or Laura Ingraham. I mean, that's not going to be a win, right? The idea is, unless we can fully vaccinate the American people, we're not going to make a dent in this epidemic and pandemic. So to try to enlist their help and see if we can get them to reverse their position and support vaccines. If you don't try, it's not going to happen. I also make the point that this is not coming out of Tucker Carlson or Laura Ingraham. This is somebody higher up at Fox News making this strategic decision, whether it's because they need it for ratings or for branding or for something else. And so there's a higher force at work there.
Yeah, I saw that point you made, which I thought was remarkably insightful, but no response, of course, just left out there. There's no Murdoch or anyone who's trying to even deny it. It's really amazing.
Well, I'm pretty small potatoes for the Murdochs. But,
I don't know. You got a pretty big voice out there, and the voice of reason and wisdom that is not easily simulated. We had the chance to kind of work together in a unique way. So back last summer, after the convalescent plasma debacle and Steve Hahn, we worked in a group that's been reported on, where we would meet every week with Steve Hahn and others to try to come up with a good path forward, especially when there was a threat that the vaccine approval could be based on 32 people in a trial at a first interim analysis. And I think we helped, at least in some way, get that on track, because the trials got finished before there was an EUA. So could you comment on that experience? Because a lot of people think that the work that we did, of course, that was only part of it, was slowing up the vaccine approval rather than trying to make it as valid and confident as possible.
Well, you see what's happening now with the AstraZeneca and J&J vaccine. I mean, those could be in free fall, but it's because we worked with Dr. Hahn and others to maintain that very rigorous phase 3 clinical trials, that we've been able to maintain the level of confidence that we have before. So much so that it was kind of interesting that a couple of the anchors that I was speaking to, because I basically made the statement that I thought putting the J&J vaccine on pause was the right thing to do, given the severity and to maintain confidence. They argued with me. They said, but it's only, one in a, X number of events. And so it was that, I thought that was kind of interesting that we had, we and together with the FDA had done such a good job in showing a high level of rigor for the clinical trials that there was a lot of public confidence around that. So that was a sort of a nice thing that happened, I think.
The pause seems to have gone on quite long. What exactly do you think is needed for the vaccine to unpause, or for some sort of declaration to come out?
I think the best outcome would be one. I think it's clear that there's going to be an association. I think the best outcome is if the FDA and CDC can identify a specific population at risk for this, and the better the better they can surgically fine tune it the better off. So, for instance, the best outcome would be if they said, look, this is happening overwhelmingly in pregnant women on birth control, or premenopausal women on birth control. I'm sorry, pregnant women on birth control. Premenopausal women on birth control, or premenopausal women who just delivered, just had a baby. I think that would be a win, because that's a very defined population. We could vaccinate our way around it, and then continue to move forward. That's probably going to be the best outcome. I think, the more likely outcome, though, is that that it won't be that specific. They'll put the black box warning on it, and if that's all that happens, I really worry about with public perception and everything else, because we have choices. And it's not so much that would be a catastrophe for the U.S., but when you look at what's available for sub-Saharan Africa or Latin America, what your choices are pretty much all adenovirus vectored vaccines right now. It's AstraZeneca, J&J, or Sputnik V, which probably is also doing the same thing. It's just that the Russians are so aggressively pushing it on low and middle income countries with no pharmacovigilance systems. We have no idea what's going on with that. So what I worry is that confidence in the whole COVID-19 vaccination program in low and middle income countries could evaporate, and that could be the fallout from what J&J is doing.
As you point out, the South Africa, the variant identified there, B1351, responded really well to J&J vaccine with high efficacy. And so the idea that, that's now put on hold in South Africa, it's really unfortunate. And hopefully this is going to be a short-term thing.
Yeah, we're trying to come in with our recombinant protein vaccine, which is looking really good. This is with Biological E in India. It's high neutralizing antibody titers in human volunteers, great in non-human primates, and it's about as an old school vaccine, same technology as the hepatitis B vaccine that's been around for decades, and it's a recombinant protein, high producing yeast strain. There's no upper bound to what you can make. Biologically, in Hyderabad's making 1.3 billion doses. We could easily make 4 or 5 billion if somebody has an interest in it. So hopefully this is a recombinant protein on alum with CpG as a oligonucleotide, and it looks tremendous. So hopefully that will come around and make a contribution. The interesting thing, though, about that is, in the beginning, when we were talking to the science policymakers about our vaccine, there was actually very little interest. Everybody was so focused on the innovation that's all they wanted to hear about. They wanted to know about, mRNA vaccines and adenovirus vectored vaccines, and nobody really cared about a boring recombinant protein in PICUA. And I think that was a big mistake. I mean, I'm an MD PhD. I love innovation as much as the next person, but I think they went too far in that extreme, to the point where, and in the beginning, I mean, I have to tell you, a year ago at this time, I was very depressed, because not only was I throwing darts at the Trump White House and their disinformation campaign and getting beat up, I was raising money for our recombinant protein vaccine, and we were only getting a little bit of support from NIH. I was going to private sources, and that was hard. So I had to spend the first few months of the pandemic raising money, and we did. We raised about $4 or $5 million to do the technology transfer to Biological E, and now CEPI is coming through and the others. But that was a tough time, and hopefully now, and if it looks as good as it's looking so far, we can get a much larger investment to move this forward for the world.
As you just said, the federal government now looks very, very different than it did earlier in the epidemic. But nevertheless, are there things that you think the federal government should be doing that they're not doing? You mentioned that they should take anti-science much more seriously, weaponize it, so to speak, or treat it as something weaponized. But what else could they be doing?
I think there's 3 or 4 things. One, in terms of the anti-science, I think they have to become more confrontational, because, and that means being confrontational with Russia to get them to stop taking down some of the anti-vaccine content. And again, that's not a thing people like to do. But if you need to save lives, I think it's going to be important. It's not just the United States. I think the UN agencies need to do this as well. I think the other piece is, recognize that when we are trying to build vaccines, innovation is important, but we also need to pay attention to low-cost, unfussy, durable technologies that you could scale for the world. And there wasn't that recognition. I think the third is doing a better job building capacity for developing vaccines. The model of relying on the multinational pharmaceutical companies and then something trickles down to Africa or Latin America did not work in this instance. And so right now, no vaccines are made in the continent of Africa. Very little is made in Latin America, not a lot in the Middle East, almost nothing in the Middle East. And we need to, that's a long-term project. And I think it's doable and really important because there's also vaccines for a lot of diseases that aren't being made because they're of regional importance. I mean, right? No one's going to, 90% of the schistosomiasis cases are in Africa. No one's going to make that. Or Buruli ulcer or in Africa. So we need to have that expanded capacity. And then when I say that, they say, well, it's all about the patents. I said, no, I mean, it's not really even if you were to liberalize patent restrictions entirely, that still wouldn't make a difference, at least in the short term, because we don't have the human capital trained. People don't know how it's not like patents are not like a small molecule drug, like an antiretroviral drug made by Cipla. There's an art to developing vaccines and years of experience. You need not only how to scale up production, but in quality control and quality assurance. And we need to build that capacity as well.
With all the experience you've had with these different diseases, and then to watch going from a sequence of SARS-CoV-2 in January to the completion of large trials, 10 months later, and EUAs granted, and now almost 900 million vaccine doses given around the world. How do you frame the COVID response with respect to vaccination, even though obviously it's got a big gap for planetary needs versus all the others that preceded it?
Well, a few things. When we say all over the world, I mean, the overwhelming number of those doses have been given in North America and Europe and maybe, some in some better off Asian countries. We've not seen a lot of, the ratio of vaccinations in North America compared to Africa is 40-1. And it would be even higher if we exclude Morocco, because Morocco is, for whatever reason, is overachieving in terms of vaccine access. But if you just look at sub-Saharan Africa, it's probably 100-1. And I don't see that ending anytime soon. So it's clear that the U.S. looked after itself, Israel looked after itself, England looked after itself, a few Western European countries looked after themselves. And it's not, it's not that not that efforts weren't attempted, right? I mean, the COVAX sharing facility is a good mechanism, and it's very sound and well thought out and ethical. The problem is the vaccines aren't there, because you're not going to do this with an mRNA vaccine. The technology is too new. It's too hard to scale. Eventually, we'll figure it out. In 3 or 4 years, we'll figure out how to scale those lipid nanoparticles and probably even keep it stable at room temperature, but not in time for this pandemic. And we knew that. So there was, again, coming back to this, there wasn't enough. There was a science policy failure that didn't recognize the urgency for balancing the portfolio with lower cost, easy breezy, unfussy vaccines. And look, I was the beneficiary of the Pfizer BioNTech vaccine. I'm grateful. And they're great vaccines. But that's unfortunate. And then the question is, what are lessons learned? Should we now be teaching countries in Africa how to make mRNA vaccines? Is there still a role now moving forward for the old school ones? I think so. I think for me, one of the surprises was we couldn't really predict which ones were going to work. mean, for instance, if you had told me a year ago, what horse would I bet on in terms of a vaccine that was going to be the most effective, I probably would have picked the same one used for the Ebola vaccine made by Merck and Company, which was vesicular stomatitis virus. It was amazing, right? It has a really high level of efficacy. And the fact that they were able to vaccinate DR Congo under incredibly difficult circumstances, that's probably the one I would have said was going to work. But it didn't. It tanked. It wasn't work at all. And the same thing now is with the mRNA vaccines, is that one of the things I point out is it's a pretty low-hanging fruit in the sense that pretty much anything you do to induce high levels of virus neutralizing antibody works. So the mRNA technology worked really well for this one, but it's unclear what's going to work the next time around. So we have to keep a lot of different technologies in play.
You mentioned that we were not taught in medical school to deal with some of the things that you've come up against in your professional career. And yet, if you study narratives of the pandemic, beginning with The Plague by Camus and the Decameron, it does seem to me that this kind of social turmoil is entirely predictable. In some ways, you're very much reminiscent of the hero of The Plague, Dr. Bernardio, and you're fighting against all the odds and hanging in there, which I think is a great compliment to you. But what I'm getting at is, should we be entirely surprised that, in your experience with pandemics previous to this, are you entirely surprised at the kind of things that you're having to deal with? Are they not in some ways predictable, part of the pandemic?
I think that the couple of things that I didn't predict are the anti-science aggression to actually interfere with it. Maybe I should have, but certainly what Trump did with launching this anti-disease, anti-science disinformation campaign, but the fact that so many other political leaders adopted it as well, like Bolsonaro in Brazil or Duterte in the Philippines, or what we're seeing now in Tanzania, or Daniel Ortega in Nicaragua, and a few others. That one I didn't anticipate, that a leader of a country would throw his own population under the bus which turned out to be for political gain, which in Trump's case turned out not to be political gain at all. Maybe was his undoing. And then the behavior of Russia, that so transactional that it would launch a disinformation campaign to discredit vaccines and to use the opportunity to destabilize democracies in the middle of a pandemic. That I think was a level that I didn't think global leaders could descend to, but there you are.
As we're talking, Peter, I think of you really as the pan man. That is, you have a panoramic view of this. I don't know, there is another person I've met that is, the biology, the political framework, the science, all this. But that brings me to perhaps where we're headed. Many have thought that we could develop a pan-coronavirus vaccine. And with the success of the spike protein being such an incredible target, as you've reviewed, perhaps better than even anyone would have anticipated, and the fact that we're seeing in rare people mounting these, pluripotent antibodies against multiple targets of the virus, and also the way we can go after it with synthetic structural biology. Do you think that we should be putting resources towards a pan-coronavirus so that we are not going to face this again?
Well, actually, about a year or maybe 2 years before the pandemic, we had put in a grant to the NIH to make a universal coronavirus vaccine. And it got triaged, unreviewed, because they said it wasn't innovative. and they were right. It wasn't very innovative, but I think we could have gone pretty far with it.
Wow.
And so I still think we need that. Look, we've had SARS in 2003. We've had MERS in 2012. And then I said, it's only a matter of time before we'd have another one. And sure enough, COVID-19 came along. But I think we're going to have, in addition to the variants, we're going to have COVID-26 and COVID-32. And so we should get ready for that. And I think one of the lessons, with each pandemic, it's not like we don't learn anything. We do. I mean, after SARS, we put in international health regulations, IHR 2005. After H1N1, we put in the global health security agenda. After 2014, after Ebola in 2014, we put together CEPI. So it's, and after Zika. So it's not like we don't learn things. I think for this one, it's going to be really important to get ready to put in some infrastructure now for coronaviruses, just like we do for flu, right? There's a pretty elaborate dance now that we use for influenza, for monitoring the emergence of new strains, whether it's seasonal flu or pandemic flus or avian or porcine flus, and then quickly turning around manufacturing. And I think we're going to probably have to put a similar type of infrastructure in place for coronaviruses, and that'll be one of the lessons learned as well, that we need to do that wide-scale surveillance and also work with disease ecologists to better understand how these emerge from bats and ultimately transfer to people. We've got to put that whole thing in place.
Peter, I'm just in awe of how much you managed to get done at so many different levels on so many different fronts. And, I think when you're all done with this pandemic, you need to write a how to manage your time book, because you're clearly doing it better than most of us. I just don't know if you sleep at all.
Well, what's funny is because I seem like a nice person, I always get invited to these work-life balance panels, and I always refuse to go on them because the truth is I just work all the time. I get terrible anxiety when I go on vacation. So, and I have a wife who's been with me for 35 years who puts up with it. So that's, and for me, it's not work. It's just, I don't know what you call it, a calling or whatever.
You're a force. You're a force.
But work-life balance, as any of my adult kids would tell you, work-life balance is not a strength.
Well, just in closing, Peter, you've represented the medical community so much in your efforts, not just when you were special envoy to the Obama administration, but over the past, well more than a year now. I get to see you almost every day through cable news, and your insights, the consistency of your efforts to try to get the truth out there. And even to take on the naysayers of the anti-science is really, we're indebted to you. So, Peter, I know even with all the sobering messages you've transmitted today, you still maintain a smile. You still have that upbeat, get it done attitude. And we really appreciate that. We appreciate all that you're doing.
Well, thanks. I think, one of the lessons that I've learned, going on the cable news networks every day almost, is the American people have a higher tolerance for complexity than we've given them credit for in the past. They actually like hearing from scientists. They like understanding our assumptions, how we think through a problem. And we don't let ourselves do that enough. I think, it's somewhere in our training we were told we have to speak to people like they're in the fourth grade or the sixth grade. And it's not true. It's people, especially when their own health is concerned or their loved ones, they don't mind the complexity. And they like going into some detail to understand what's going on. And I've really enjoyed that opportunity in order to do that. But I think it's also a lesson for how we train physicians and physician scientists is, all three of us have learned all of this by trial and error, right? In my case, more error than trial, and that we don't provide. I mean, if you talk to young medical students, despite what they say about that generation, the truth is their commitment to public service is at an all-time high. They want to do this. We just don't give them the tools and the support to do public engagement in health and science communication. And I think if, for reinventing medical education or residency education, I think another message is let's build that into it. I think it'll go over really well with this generation. And that's why what you guys are doing is so important, right? I mean, these kinds of Medscape podcasts are gold, right? Because this is what people need to hear and see that side of medical practice, communicating health it's something that's not widely done, and it's so critical what you are doing.
Well, that's kind of you, but you are the role model, and hopefully one of the lessons out of this pandemic will be don't stay in your lane, because if you had, Peter, we wouldn't be very well off right now. So thank you.
Well, thank you for having me. Thanks for all your great work.
Thank you so much.